Welcome to Horton Implants Oral Bites with your hosts, Kate Bootman, Will Murphy, and Carl Horton.
Fan, I'll drink brandy.
What?
Oh, brandy.
Oh,
Yeah, brandy.
Right.
yeah. 5 star.
Hello, everybody. Welcome back to our weekly webinar. The boys have already started. You can hear. Hello, Will. Hello, Carl. Hello, Jag.
Hello.
Good evening, boys. How are we all?
Good.
We're good. And you are who?
Good. Mr. Murphy. I'm the one that's tasked controlling you boys. You've had a couple on your own, and now I'm back. Jag,
can't be
anytime you want to
trusted.
stick up for me, feel free. Right then, gentlemen, let's dive right in there. Will Murphy, how has your week been?
My week's been, very good. I've used my little Crestal sinus kit 3 times this week. So
On a patient?
on a patient, yeah. I thought it'd be the best way to go about it.
Did they all need it? Or did you just want a little bash with it?
Huh?
Did they all need it? Or did you just
In the
want a little
mandible.
bash with it?
Nobody needed it whatsoever. But I thought, what the hell? Got to give it a go. So three of those, and that was all quite nice. So
You pleased with it?
Hmm?
You pleased with it?
I am pleased with it. Yeah, I never quite know whether I should shove a load of biomaterial in, not shove material in, just allow bone to do its thing, blood to do its thing.
Well, the implant just
right,
attentive.
shove.
That's how it works, with just blood around it. So some people will just use blood. You don't quite get the, if I can call it, the money shot X-ray that you get with a lateral graft, where you've got a nice dome of material around it. So a couple of them I put a little bit of MP3 biomaterial in.
To make it look better on the X-ray.
To make it look better on the X-ray.
Yeah. Photoshop, mate.
Yeah, or just sort of insecurity, really. You just think, maybe if it pads it out a little bit. But there you go, we'll see. And the other one, there was quite a lot of blood there, so I just thought that'll do the job, won't it? So, pretty happy with that. And I should be giving a shout out to Dent Supply because I've become an ambassador by all accounts, which is very fancy, very grand.
Ooh.
Yeah. So I don't know what it means. I think it means I have to give out Ferrero Rocher at parties or something. Was that the advert? The ambassadors' parties?
Yeah.
Somebody will. Yeah.
Something like that. So, that's as far as I know. So I think Saturday I'm going up to Liverpool to try out some top secret implant, which I can't talk about. Otherwise, James Bond will put a bullet in the back of my head or something. So I never mentioned it. I never said nothing. Don't know what you're talking about.
Didn't hear, mate.
Raise,
Signal was really bad.
Raise this from your memory.
Yeah. So there you go. That's
Wow! Well, congratulations,
nice, mate. Well done.
Will Murphy.
Yeah.
When you're all more important
congrats.
than you are, just remember us.
well, yeah, and I'd like to be addressed as the ambassador from now on.
Oh,
the
Will.
ambassador, not
Yeah.
a ambassador.
Will,
The
The
do you want this cup?
Yeah, get it down here.
That is a good call.
Oh dear.
Can we cut that
You
bit,
sound like
Dave?
you've had a good week.
Yeah.
I think it will be left in. A good week, Mr. Murphy. I like that you got some new toys. I love it. I love to hear when people have got new toys to play with. That's great. Is that gin? Neat.
Yeah, of course.
One-upmanship on Jag, is it?
Exactly. Everybody's got to show their drinks. Who's got what?
Oh, not me.
You've got.
Yeah. It's gone now.
What?
Right. Carl Horton.
Yeah.
Oh, go on, Mr. Murphy. What?
No, there used to be an airline called TWA, didn't there? Once upon a time. So,
Before my time.
so you've officially got TWAT. Thank you very much. Good night.
Before my time. Yes, that's right. Yeah. I flew with NWA as well once.
Oh, really?
Oh,
Yeah. Yeah.
I used to like those in the 90s. They were a bit of a rap band, weren't they?
Yeah, they were, but unfortunately, it was the airline NWA. But
okay.
they gave out cards with NWA written on the cards. In fact, it's when I used to drink, and the guy that was looking after us on the flight back took a shine to me, and I ended up with unlimited wine. I couldn't get off the plane. I couldn't walk.
Do you remember?
Yeah.
I was saying, do you remember when you could smoke on a plane? Not that I smoked, but remember you could actually smoke on a plane.
Yeah.
It seems like quite so many years ago.
Well, do you know what?
Remember what it was like going on a plane?
I'm glad that you kind of.
Yeah, good point.
But I remember being on a plane where I was the row in front of the smoking, the last row of smokers. And so what people were doing were exchanging seats all the way through the flight so that they could come from the front, non-smoking, sit in the seat behind me to smoke. So I think I got about 2.5 hours, like surrounded by plumes of fag smoke, and smelled pretty rancid afterwards.
So what have you done?
Who touched it?
It wasn't me. It wasn't me.
Who's broken it?
Yeah.
We got 3 seconds. 2, 1.
Back in the room.
Yay.
Back in the room.
Well,
Apart from Kate.
yeah.
Has she gone on holiday again?
Yeah. Yay.
Mr. Murphy?
Am I being cheeky tonight?
I have no idea what happened then. No idea.
Fortune
You
break,
were,
are we?
more than normal. It's that
Yeah.
gym.
What is it? At the bottom of my screen, it says room exploration.
Yeah. Don't worry about
What is
that,
that?
mate. It's when we all get properly kicked
Don't
off.
worry, we're going to eject you.
Yeah. You got a few hours
Right,
yet.
Carl Horton. What about your week?
Yeah.
What about your week?
Went to Hereford. That's a clinic where we've almost finished. So it was nice to see a
Hereford.
full arch bridge patient. Check he was doing all right. Yeah, he's doing really well. And then had a full arch case. Which went really well. Again with Phil Morris doing the workup. So that was nice to see. Beautiful result. And then Newtown, where it made it onto Radio 2 because the church opposite, the roof caved in, so the road's been closed. So that's my claim to fame for the week with Newtown. And then today over in the lovely Malvern, lots of consultations coming through. Again, some more immediate full arch loaded cases coming in. There, lots of people seem to be more aware of it, so they're actually asking for it. Ask the Jag, careful, mate. Don't want any straighteners. Not that kind of asking for it, not your kind. So it's, and they want to know what aware of what 4 stands for, pro art. Quite nice to, be able to advise them when they've done their work. It makes the consultations a little smoother, I think. And then just fit in some nice work. Yeah, that's about it, really. In a nutshell. Everybody's gone quiet.
Jag, what about you?
Exactly,
What's your week been like?
Shit. I sort of now think of myself like an implantologist, and like when you have to see just normal checkups, it's like this shit is beneath me. Do you know what I mean? You guys do a lot more implants than me, yeah.
You want to
I have to do general dentistry, and it's like when you
join the diva panel of Will and Carl. Oh, this is so beneath.
Yeah, well, it's just like
beneath me.
It's just like, what's a DPE? It's been a hard week. When you start thinking it's a hard day, the day automatically gets harder. But yeah, I had a lot of implant work in, and so it was just nice seeing that. I've had a couple of failures last year. I think everybody had. So I had a couple of the ones which failed, and I've redone, and it's got to the point where I'm exposing them. I've gone back to basics. There's no placing an implant and putting a healing abutment on. When you get a couple of failures, you sort of go back to gold standard. So place implant, cover screw, cover, and then expose, healing abutment, and then impressions. I'm finishing off the ones that had failed, so I'm happy. I had a scare today. Patient walks in and she's in for an exposure today, and she goes, something fell out. I was like, please don't let it be an implant. Please don't let it be an implant. And she pulls this thing out, and I can see it's grey. I'm thinking it's a fucking implant. It's a fucking implant. You know what I mean? I'm thinking it's fucking. She puts it on. You know, they always try to give it to you when you've got no gloves on. It's like, no, just put it on the tray. Put it on the tray. She puts it. It's an MOD amalgam. And what's strange about that is, I look at it. I know she's got no MOD amalgams. So I'm like, where does this come from? And she was like, out my mouth when I was eating.
So you were saying,
it's
you're lying.
Not
it's somebody else's MOD amalgam.
Somebody else's MOD amalgam.
Oh.
Yeah. Oh. Where'd
I
she get that from?
No.
She's like in 70s. I don't know if it's her husband's. But it's a full-on MOD. And do you know when the amalgam's like black? So you know that's like 15, 20 years old. You automatically can gauge that. 15, 20 years old. It's like, where did this MOD amalgam come from?
Yeah.
So
it sounds like you interrogated her a bit on that one.
No,
You don't want to let that go. You need to find out where it came from.
So are these MOD amalgam fillings, when they come out, are they like tree trunks? So could you tell how old the dentist was who put it in with their thumbprint?
No, 110. Sorry, I got to pay some bills.
Keeping it real, Jack.
It's real life, man.
Yeah.
Real life.
Sorry, what were you saying? I can't multitask.
Don't worry, Jack.
You were gonna deposit a couple of grand into Will's bank account.
Why Will's? So if
I don't know. I just made it up.
If we put it into Will's account and he gives it to you, then only he's liable to pay it back.
We just move it offshore.
Yeah.
Actually, that's an interesting point. With this
Don't mention cash. Kate was almost going to take cash off a patient today.
No. Taking cash beneath you. You pass that on to somebody else.
And declare it, obviously.
Oh, well, of course.
Always.
I had a present this week, actually, off a patient. I know you're not allowed to accept presents, but this is a different present. And I was super excited. Was I not, Carl Horton?
Oh,
it's that exciting. Carl's left.
Yeah, unfortunately, my signal's really poor, so I'm only hearing half the conversations.
Well, boys, let me tell you. One of our patients is an equine dentist. So I was straight away, questions. And this was before lockdown. And he said to me, I'll bring you a horse's tooth in. It sounds like a joke, I know. And he did. He brought me 2 in this week. They're massive and heavy.
Oh. Have you seen how they have to take out some of the teeth? So they
That'll be next, hopefully.
you got the horse's head, nose, and you have to actually drill with the trephine to get to the tooth. You can't. Yes, you have to drill with the trephine from the top. Or was it from the bottom?
Wow.
That's what I was told.
Depends which.
Well, these teeth are amazing.
I was at the prison, and I didn't know this yet. I was working the prison yesterday, and they told me I could only work half a day. Sorry?
Nothing.
Oh, no, yeah. Your reception's bad. So I was at the...
Yeah, I know.
And they said to me I could only work in the morning, and they didn't say why. So I just worked the morning, and I was about to piss off home, and they said the reason why I can only work in the morning is Princess Anne's coming in.
Oh.
Yeah.
Wow.
She's checking out the place of Prince Andrew.
Is there going to be a royal suite there?
Yeah. But she did come, and honestly, Princess Anne is probably one of the nicest royals. You know, she's not in your face. She does a lot of work, and they said she was lovely.
Ah.
It's
Sounds like
you
you've
with the
met a
Moss
few.
connection. Is that what?
Royals. No.
Yeah.
No.
Oh, he's keeping that
No,
quiet.
but you hear some Royals are
Well connected.
Yeah.
It's not what you
Man,
know,
not what-
it's who you know.
She
Yeah,
didn't,
exactly.
She didn't drop an MOD amalgam off, did she?
I don't know where that's disgusting. I don't know where it's come from. Has she eaten some food that somebody's like lost an MOD amalgam in?
Well,
Oh,
Let's not. No.
She puts
Gentlemen,
her
I've got a
husband-
question. I've got a question for you all. I've got a question. I'm intrigued. I've been listening to some of the clinicians over the sort of last couple of months and the bits and pieces they like in their work. So you all place implants, okay? So I want you to tell me your favourite part. So is it, the engagement at the consultation? Is it the surgery? Or is it when you come to fit the restoration?
Can I have an
What do you
option
guys-
4?
Oh, finding the MOD amalgam?
Getting paid.
Yeah. Oh, where? Jag, no. Come on. What's your favourite? Carl Horton. What part's your favourite?
I would say no. Actually, I've got two different ones. I actually like doing the surgery because I like doing the surgery and fitting the restoration. Do you know what I mean?
Okay.
That's probably the most. I actually probably prefer doing the surgery. Most of my patients are fine. For me, it's just like I've treated some of my patients for like 12, 13 years. So with me, for being, I don't know, selfish, I like doing the surgery.
Yeah.
I don't know if you two guys are the same. Surgeries, it's sort of pushing the boundaries. You're not doing general dentistry. You're pushing the boundaries on what you're doing. What Will and Carl do, only a small percentage of dentists can do. What they do day in, day out, 99% of dentists can't do. And then fitting is nice because it's actually changing their life. You can see like getting rid of a denture, getting rid of a gap, appearance. It does change your life. One of the best cases I did was in 2013. One of my patients had a denture for 40 years, and I did a implant retained bridge, and she was just so happy to get rid of a denture. She didn't know any better, if you know what I mean.
40 years is a long time.
Yeah, because you have some patients who lose a tooth, lose some teeth, have a denture, and they know what it was like without the denture.
Yeah.
They're the most upset, and it bothers them. And you have some people with the denture, and they know no better.
Yeah. Yeah. Okay. Yeah. No, I get that. What about you, Will? What's you're nodding? So are you surgery as well?
I think I am. Yeah, certainly surgery in the aesthetic zone. Getting that right, especially if you're trying to meet patient expectations and reproduce anatomy. So I find I'm more and more giving it more thought, if you like, just based on you can project forward to see how the aesthetics of the final restoration is going to be. And I think experience tells you a lot of things early doors. So I'm probably having more conversations with people, trying to set out the expectations, probably trying to, under promise and over deliver like we all do. But also probably talking to them more about what I'd call high aesthetic risk. So I like to throw that into the consultation so that, I'm basically saying I can't promise that, these margins will be exactly the same and so on and so forth, but also understanding the principles that I need to have my implant in the right 3D position. I'm going to need to rebuild things that have gone missing, and also probably more use of things like soft tissue grafting now, because I think that's the side of implant dentistry that's really pushed on quite a lot. I know all the digital stuff is big, but there's a lot of guys doing amazing augmentation and soft tissue work, which is pretty incredible. You can see some of these things online, and they're quite big on social media, but it's pretty incredible. Obviously, it's sometimes you need extra steps and a longer journey that the patient doesn't always understand.
Yeah.
But out of curiosity, do you?
Yeah.
You can do a simple case and just put the implant in, and the patient will have a longer tooth. Some patients are happy with that step. Do you know what I mean? You bury the implant, but do you actually say to the patient, or we can add bone grafting, soft tissue augmentation, and we can get a better aesthetic result? So, or do you give them that option? Or
yeah, well, I usually try and have the conversation that sets the stall out. So obviously when I'm talking to them and I'm asking them to do a bit of a fake smile so I can see what the lip line is, and also just assessing what their aesthetic expectations are. So if they're telling me they're expecting it to be like a normal tooth and it's going to last forever, then obviously we're backpedaling a bit and saying, well, okay, hang on. I'm using GBR in 99% of cases in the anterior zone, and more soft tissue grafting. And what I'll do is I'll put it in on the treatment plan, and I'll say, if there's a lot of a defect, then we're going to do a soft tissue graft at placement, or we're going to assess you at the exposure stage. And if we feel, we want to get maybe a better aesthetic result, we'll do the soft tissue, connective tissue graft at exposure, give it another 6 weeks, and then re-expose and take our impressions then. So that's kind of how I'm doing it, really. I mean, I'm trying, in the back of my head, I'm trying to get everything to look great, but sometimes you just can't. And also there's patients who literally couldn't care less.
Because the other thing is, I find is, sorry to jump in, I do a bit of ortho. I know that's beneath you two.
No, I just don't understand it.
But what I find with patients is the more work you do on the more they look at their teeth. So I've straightened up people's teeth, and they all say, "Oh, this tooth is slightly curved," and it's like, Jesus Christ, you came in like Jaws.
Yeah.
No, but
short memories sometimes. Yeah.
The more work you do on people, the more they look at their teeth, and the more they pick on little things. Like you've sorted the macro problem, and they start looking at micro problems. So I find that with ortho, I mean, it's all right. You can do a bit of composite bonding and just make it better. But I find that, the more work you do, the more they look at their teeth. And it's not a bad thing, because say if I have a patient, I'm doing like a crown, it's one implant on the central incisor, they've got old crowns either side, I'll say to them, do you want these replaced as well? Because it will make it look worse. Most of them do. The odd ones say no, but then after I've changed the crown, they can see how bad the other teeth look, and they have the other crowns changed as well.
It's like relationships in reverse. So you got to make lots of effort when you want to grab somebody's attention and all that sort of stuff, and then it just gets married, and it just goes down and down and down and down. It's the opposite way round, Jag, when you start putting more effort in. So the lesson from there is just don't put the effort in. What's the matter with you?
Yeah, it's like all my jokes used to be really funny at the start of the relationship, and now they just seem to be
the same jokes.
Really annoying.
They're the same jokes. Mine are the same jokes. The other thing I've been using quite a lot is that ISQ machine.
Oh yeah.
Because most of my patients are old. They're like 50 plus.
That old?
How old?
Almost dead.
Yeah, dead. And I find
almost at 50. God.
Yeah. So like I will, I'll expose, and the machine is quite good because sometimes I'll only have an ISQ of like 55 after 3 months, but I'll expose, put the healing abutment, and I'll leave it like another month or two, come back, check it again, and the ISQ is shot up to like 70. Some people, I think it's a great machine because there's nothing worse than putting a healing abutment on it. I think, I'm sure it should be tighter now.
Yeah, love a spinner.
That's a subcrestal. That's a subcrestal implant. So I think that's probably sort of made my life a bit better. It's more predictable than.
Brilliant.
But most of my patients, the ones I've just left it, like I said, all of them was the ones I've just left it. There's some with loads of granulation tissue. You take an X-ray and you know it's buggered, but most which look good on the X-ray, and if they've got low ISQ, you leave it for a few months, they last.
Oh gosh, you lot. Carl, what about you? What's your favourite part? You've sat there quiet, unusually.
It's because signals. Favorite part was that the question?
So,
favorite part.
Yeah. Consult, surgery.
So is that why Jag said the money?
Yes.
Yeah, brilliant. It's got
wasn't an option.
For me. I think that both Will and Jag have touched on some points that I really do like. I mean, when you get those comments from the patients and they say it's changed their lives, that's lovely to hear. That's really nice. That's why we do it. But for me personally, it's the surgical side. So when you're such things I like are sort of when the flap just lifts really nicely off the tissues, you haven't got to fight it. That's quite a nice feeling. When you've got some granulation tissue in there and it just feels. When you've got some granulation tissue and it just peels away and and that's quite a nice, satisfying feeling. And then I think Will was kind of touching on it, and the soft tissue work and the grafting work when you're rebuilding that and you know what the end result is going to be. So you've got that end result in mind and you're reconstructing everything on a very small, basis, but you know that aesthetically all of Jag's patients are going to be really pleased because they can't pick it apart because you spent the effort and the time getting that regeneration. So, do you know what, mate? I know what you mean. I know what you mean. And like Will said, it can be a challenge. And sometimes I think with the consultation, a lot of the time is listening to the cues that they say to kind of pick up whether we've got somebody with a really high aesthetic need that is going to pick on every single little detail, or somebody that's just like, I just want a tooth. And, I just want to be able to chew. And there's a very different, I've put some implants in, at the sort of the 7 site, which you think would not be an issue. And they've kind of picked up, oh, well, the gum doesn't look quite right there. And, I'm thinking, how on earth have you managed to lift your cheek that back and get somebody else to take a photograph and tell me that you're not happy with it? And it's quite a surprise sometimes, the aesthetic demands that you have to meet.
I think that's good, but it comes with experience, like you two said, is when you're dealing with patients, you pick up those cues in the initial consultations.
Yeah.
And you learn from experience. You can be told what to do a million times, but when you actually do it yourself and have issues with some patients, then you'll definitely learn.
Yeah.
You would have learned from those early sort of like alarm bells.
Yeah, you're right. Yeah.
Managing the patient's expectations, I think is a massive job in itself, never mind the complex surgery and all the other wonderful skills you guys have that take the patient through their journey. But managing a patient's expectation is difficult.
Oh, cute.
You see that?
Woof. I've just been bombed. It's like Dr. Doodle today in this house. You're right.
But I think everyone's like an Amazon experience. Everything's they want a slick experience. When they first have a consult, they come in, everything's done like people want things back quickly. The treatment plan, being booked in for a consult, a follow-up. They want it done quickly and smoothly. They want, when you have a slick operation, they feel more confident. I think the biggest uptake in my practice was just having the CBCT.
Yeah.
Because before we were sending them out, but because you have the CBCT there, they can have it done, and it's all slicker, isn't it?
It's a nice flow for them, I think. You can be more,
Yeah.
I think it really helps because you can be pretty much definitive on the day, really, with the CBCT. And there's not there's that waiting game, that anticipation. There's I think it just helps. It's the same. I think if we went in for, something where we were being diagnosed and then they turn around and say, well, you've got a week or 2 weeks to wait for your scan, and then you've got to wait for the report on the scan. I think that can
usually about 6 months, isn't it?
Yeah, but that would have been acceptable sort of 10, 15 years ago. But things, there are like some of the dentists out there, so these Instagram dentists. If they did real dentistry. No, sorry. No, I mean, we have to learn from, if we don't learn, we should be learning every day. If we don't learn from these people, what makes them successful is, it's a slickness. Patients can send a message, email, WhatsApp message, and it's instantaneous. And some of them are working sort of 24/7. They have somebody on the end of the messenger to message back straight away. I think we need to learn. We always need to learn. So it's not even our surgery. You could be the best dentist in the world, but it's the whole practice, the whole patient journey, as Kate was saying.
100%.
Yeah.
That's why I've ordered a marble worktop for the reception. Ben doesn't know yet, but I've picked lovely white marble worktop.
Ooh, fancy.
Jag.
Yeah.
Can I be there when you tell him?
I ain't going to tell him. I'm just going to be hiding in my surgery. He'll come in and he's like, "Oh, what's that?"
We'll hear him.
I'd slow down on the patients so I have a backlog so he hasn't got time to come in. Well, but I think it makes a difference. When like some of these dentists, this I actually looked at you see their surgeries and they got like Forest dental chairs. Who the fuck is Forest? And I've seen the dental chairs, but you look at their reception, and the reception looks amazing. And the patient only remembers the reception.
Well, to be fair, I know exactly
how
what
you
you're saying.
make them
Front
feel.
of house. Yeah, front of house. Yeah.
Front of house looks good.
100%.
We all aspire to have sort of like A-deck, Belmont chairs. There's loads of other good ones. I'm sure Forest is good. But it makes no difference to the patient. The front of house makes a big difference. The patient doesn't know anything in surgery. My surgery, I haven't got a chance to renovate it. I'm adding extra storage into it. It looks like Frankenstein surgery.
Have you still got that? Have you still got that foot pedal drill?
Oh no! I have the best equipment. Ben will know. Like Ben always walks into my surgery and says, "Why is your surgery so good?" And my surgery's got crap. It's like, order all the goodies. Just open the Henry Schein catalog. Order what you want. But I haven't got the downtime to renovate
That's not
surgery.
what Ben says. Ben says you go to the shows and then you just put it in your pocket.
I went to the trade show 2 weeks ago.
You're supposed to deny that, mate.
All property is theft.
Park up the van. I went to the trade show. The government said they weren't going to bring out this COVID passport.
Yeah.
And I'm driving down to the show, and I spoke to somebody who's there. And they're like, "Oh, have you downloaded the NHS app?" And I was like, "What are you talking about?" And they're like, "They're checking that you've been double jabbed." So to get into the London trade show, I had to download the NHS app and show that I've been double vaccinated. But I think the government were going to do a COVID passport. Did you not know about this?
No.
I take it that's a no.
I had no
So
idea.
to get into that trade show, I had to prove that you've been double vaccinated.
Well, that's how you'll get on planes and all the other nonsense, is by having the app and showing that you've had your jabs.
But the government's, I've been vaccinated. I'm not a whatever anti-vaxxer, whatever they are. But the government said they weren't going to bring this in.
Yeah.
So if I wasn't double vaccinated, then I couldn't go to the trade show. I agree that you should be vaccinated.
Can you screenshot the little bit on the app and just send it to any of your mates?
Yeah, that's what people do.
Yeah.
Yeah.
Oh, that's clever.
Yeah.
Guys.
And people use the same codes, when you come back and you're supposed to have a test when you get home.
Yeah.
Yeah, apparently, people just reuse somebody else's code.
Brilliant.
Don't have the test because nobody checked.
There's nothing you can't. Doesn't surprise me about people's ingenuity to not get something done.
Yeah.
to get around actually doing it.
Scams are us.
How much are you charging for your code then, Will? Hey?
My code, yeah, just a fiver. That's all.
Fiver.
I was talking about theft. I was speaking to one of the reps, and I says, like, I'm saying to her, "Have you do you get anything stolen?" She goes, "At one of the shows, some people just turned up at the end of the show and started loading up these furnaces, which are like $4,000 a pop, and they were walking off with them. 2 furnaces, $8,000." I was like, "What the hell?" And I was like, "What happened?" She goes, "Oh, we stopped them." And I was like, "Did you sort of like?" Did they get arrested? I think she was like, "No, we just let them go."
Will
Incredible.
Murphy. You should know
Anybody want a
better.
furnace?
Yeah. On another point, did you
On
read?
eBay.
Did you read what was blowing up on the dental forums?
No, mate, go on.
Tell us.
No, about this this dentist who was racist. He wouldn't be treated. He wouldn't be treated by an African dentist.
Really?
Oh, no way.
Who's
No,
that?
I heard of that. No, really? What, the patient or a dentist would
Dentist,
be?
a
He
dentist.
said it. No,
Yeah.
seriously. And put it out there.
It's on.
Really?
It's all on the dental
Wow.
forums.
Oh, dear.
Ooh, it's going to get ugly.
And they know the name of the person, yeah?
You're right.
Yeah. It was actually an ethnic dentist of he was Asian.
Yeah.
But I guess that's going to come before GDC, would it, at some point, I would have thought?
Oh, well, it has to. It has
Yeah.
to. I mean,
Wow, that's nice.
you know, like, isn't the old age thing when you say you're not a racist because you've got like a brown friend? Does that can he say that as a defense? You know what I mean? I'm not a sexist boy female dentist.
The old,
He could use that
yeah.
argument.
yeah,
You know what I mean? Oh, okay.
yeah,
Oh, that's okay then. You're not a racist.
yeah.
Oh, oh
I don't think
dear,
that'd
dear,
stand
dear.
up, to be fair, but he could try it. He could try it.
Just you know,
Yeah.
try it. I just, yeah. I for me, I've never really. I mean, I know my parents suffered from racism. I was fairly lucky. I had a bit, but nothing untoward. But to have a dentist in this day and age saying that is unbelievable. I mean, I don't know if you've heard of inverse racism. So an example of this is when you have an Asian and they go see an Asian doctor, don't believe what he says, and they want to see a white doctor.
Oh, really?
Yeah.
Oh my
No
God.
way. Is that a thing?
Yeah. I get it all the time. They come see me and go, "Oh, can we see Ben, the white doctor?"
Yeah.
You know, the words he speaks are gospel.
And when they see Ben, do they say, "Please get me back to Jag"?
No. Ben, yeah.
Oh, no, leave it there.
Yeah,
Well,
no.
gentlemen, I think we've exceeded the magical time of the evening. I think. Thank you so much, Will, Jag, as always, Carl. Thank you, and Scylla, which made a guest appearance.
Scylla.
There she is.
Oh, Scylla Black. I get it.
Yay!
Don't start that card.
Yeah,
Don't.
okay.
We just been going down that road.
Yeah, let's get off
I
that one.
know.
Yeah.
Yes. Thank you very much, everybody out there. Hope you've enjoyed it as much as we have. Hope you guys all have a fantastic weekend.
Cheers.
And
you.
Can
See
we
you next
chat?
week.
Can we chat offline?
let you lot chat.
I'll be gone in about half a second.
Minus
Yeah.
a second. Right. See you, gentlemen. Everybody
Yeah.
out there. Have a good one. Bye-bye.
Bye.
Bye.